Hello, my name is Dr. Gregory Davies, and I am a professor of Obstetrics and Gynecology at Queen's University and the president of Stittsville Medical Imaging Center, where we offer the Mona Lisa Touch as a treatment option for the common vaginal and vulvar discomforts associated with menopause. In this chapter, I'm going to review how menopause affects your reproductive organs. You can learn more about treatment in my chapter entitled Treating Menopause with the Mona Lisa Touch. Before we go any further, let's make sure we're all familiar with the normal female pelvic anatomy. The labia majora are the larger outer lips of the vulva. They are normally covered in pubic hair. The labia minora lie inside the labia majora and are the smaller lips of the vulva. Inside of the labia minora is the opening to the vagina. The urethra, where urine comes out, is above the vagina. The clitoris, the main site for female sexual pleasure, is above the urethra. Now let's look inside your body to see what the process of menopause is doing to your reproductive organs. Before menopause, the ovary is the source of the eggs you release on a monthly basis. When the egg is released, it enters the fallopian tube and travels through the tube into the uterus. If a pregnancy is not fertilized that month, the egg and the lining of the uterus is sloughed off and passes through the vagina as menstrual blood, commonly known as having your period. The ovary is also the primary source of your body's estrogen. The estrogen stimulates the lining of the uterus, getting it ready to accept the egg. Estrogen also has powerful effects on the vagina. As you can see in this magnified drawing of the vaginal wall, it is the effects of estrogen that attracts blood supply, which supports a thick and healthy vaginal wall, which is elastic and has the cellular structure for normal lubrication with sexual activity. When the ovary is no longer producing estrogen, the effects on a woman's sexual organs are rapid and profound. As it is no longer producing eggs, the ovary becomes smaller. The lining of the uterus is no longer stimulated by estrogen, and so a woman stops menstruating. There is a reduction in blood flow to the vagina, which then becomes dramatically thinner, losing its ability to produce normal lubrication with sexual activity. The vagina shortens and becomes narrower, which in addition to poor lubrication can lead to painful intercourse. The same process is also happening to the skin on the vulva. The simple explanation as to why you are having new vaginal and vulvar symptoms after menopause is that your natural production of estrogen is a fraction of what it once was. Let's take a look at what's happening. So let's imagine that this photo represents you, your production of estrogen and its effects before you went through menopause. In this example, the water going over the waterfall and the full river is the estrogen in your body. Before menopause, relatively speaking, you are producing gallons and gallons of estrogen. Just like in this image, where the presence of water allows the plant life to grow and be green and luscious, that's what estrogen does to your vagina and vulva. In the presence of estrogen, the skin of the vagina is lush, creating normal lubrication and tone. The vulvar skin is plump and has good elasticity. In addition, estrogen is important to providing tone and support of the bladder to avoid leakage. And then along comes menopause. The average age of menopause in Canada is 51. Not only does menopause cause hot flashes, but women also commonly notice more rapid aging to the skin on their face, a shift in where they carry weight, and increased challenges in keeping weight off. Within 2 to 3 years of menopause, at least 50% of women also notice that there is no longer normal lubrication in their vagina. Intercourse has become painful. Their vulva is dry and itchy, and they more frequently leak urine, get strong urges to pee, and have to get up at night to pee when they never had to before. All of these effects are due to the dramatic reduction of estrogen from the ovaries when the brain after menopause no longer sends the signal to produce it. The symptoms that women experience related to the low estrogen state of menopause affect the normally moist skin inside the labia majora, or large lips, on the vulva, which is identified by the dotted blue line. Typical symptoms on the vulva include dryness, itching, and occasional bleeding because the skin has become so thin that even minor chafing can cause a break in the skin. The opening to the vagina can be seen inside the dotted yellow line. The typical vaginal symptoms experienced after menopause include dryness, lack of lubrication during arousal, and pain with intercourse. So back to our water and estrogen comparison. Again, the water in this picture represents the estrogen in your body after menopause, but compared to the previous image, you can see there is much less water in this photo and therefore much less water around to sustain the plant life and lots more dry land. This is exactly what happens to estrogen production with menopause. It commonly takes a few years after menopause for the lack of estrogen to have noticeable effects on the vagina and vulva, but at least half of all menopausal women will have disturbing symptoms due to dryness and its consequences. I hope you have found this review educational. If you would like to book your consultation to discuss the Mona Lisa Touch treatment for the genitourinary symptoms of menopause, call Stittsville Medical Imaging Center at 613-714-1000.